Hello, and welcome. Today, we're going to talk about a very common, yet often misunderstood, bacterium called Helicobacter pylori, or simply H. pylori. Many people are diagnosed with H. pylori, and it can sometimes be a source of worry. Our goal today is to help you understand what H. pylori is, how it can affect your health, and most importantly, how it's treated. Knowing this information is the first step toward feeling confident about managing your health effectively. So, what exactly is H. pylori? It's a tiny, spiral-shaped bacterium that has a remarkable ability to live right inside your stomach, a very acidic environment where most bacteria can't survive. Its secret weapon is an enzyme it produces called urease. Think of urease like a tiny chemical tool that allows H. pylori to create a protective, less acidic bubble around itself. This shield protects it from your strong stomach acid. Once protected, it can burrow deep into the stomach's natural mucus lining. It also has tiny whip-like tails that help it move around within this thick, protective layer, finding a safe spot. It's important to know that many people can carry H. pylori throughout their lives without ever experiencing any symptoms. H. pylori is considered contagious, meaning it can spread from one person to another. The most common ways it spreads are, firstly, oral transmission, which means through mouth-to-mouth contact, like sharing saliva from kissing or sharing eating utensils. Secondly, and quite commonly, is fecal-oral transmission. This happens when tiny amounts of stool from an infected person are somehow ingested by another, often due to poor hand hygiene after using the bathroom, or through contaminated food or water. Infections are often acquired during childhood, and it's quite common for it to spread within families. Good news, though, thorough cooking always eliminates the bacteria. It's really important to remember that most people who have H. pylori never experience any symptoms at all. However, when symptoms do appear, they are usually a sign of inflammation in the stomach lining, which we call gastritis, or the development of peptic ulcers, which are like open sores in the stomach or the first part of your small intestine. Common symptoms you might notice include a burning or gnawing pain in your abdomen, which often feels worse when your stomach is empty, bloating and frequent burping, feelings of nausea and sometimes vomiting, a loss of appetite, or unexplained weight loss. Some people also experience feeling full very quickly after starting to eat. While the previous symptoms can be uncomfortable, there are certain alarm symptoms that require immediate medical attention. These can indicate a serious complication, like internal bleeding or a perforation in your stomach or intestine. If you experience any of these, please do not ignore them, contact your doctor or seek emergency medical care right away. These include bloody or black, tarry stools, which often mean there's bleeding higher up in your digestive system, bloody vomit, or vomit that looks like coffee grounds, which also points to bleeding in your stomach, sudden, severe stomach pain, difficulty swallowing, or unusual tiredness or dizziness, which could be a sign of anemia from chronic bleeding. Doctors use several methods to diagnose H. pylori. We'll start with the non-invasive tests, meaning they don't require an endoscopy. First, there's the urea breath test, or UBT. For this, you drink a special liquid, and then breathe into a bag. If H. pylori is in your stomach, it breaks down the liquid, and a specific gas is released which we can detect. Next is the stool antigen test, or SAT. This test looks for specific H. pylori proteins directly in a sample of your stool. Finally, there's the blood test, or serology. While easy, it's important to know that a blood test can only tell you if you've ever been exposed to H. pylori. It cannot differentiate between an active infection or a past one, so it's not used to confirm if treatment was successful. A very important note for the breath and stool tests: if you are taking medications called proton pump inhibitors, or PPIs, you usually need to stop them for at least 2 weeks before the test. These medications can temporarily reduce the bacteria's activity, leading to a false negative result. Always follow your doctor's specific instructions. The other type of diagnostic test is an invasive test, usually performed during an upper endoscopy. An endoscopy is a procedure where a doctor gently guides a thin, flexible tube with a tiny camera down your throat, allowing them to visually inspect the lining of your esophagus, stomach, and the first part of your small intestine. This is typically done if you have alarm, symptoms or other digestive issues that warrant a closer look. During an endoscopy, the doctor can take tiny tissue samples, called biopsies, from the stomach lining. These biopsies can then be used for several tests: a rapid urease test, or RUT, histology, where the tissue is examined under a powerful microscope, a culture, where the bacteria are grown in a lab to find which antibiotics work best, and PCR, a very sensitive test that looks for H. pylori DNA and can also tell if the bacteria are resistant to certain antibiotics. The decision to treat H. pylori is crucial and isn't recommended for everyone who tests positive. If you have H. pylori but are not experiencing any symptoms and have no other specific risk factors, treatment is generally not advised. This is primarily done to help combat the growing problem of antibiotic resistance, and to avoid unnecessary side effects from the medications. However, treatment is strongly recommended in specific situations due to the known health risks. These include, if you have active peptic ulcers, or a history of them, a rare type of stomach cancer called gastric malt lymphoma, an increased risk of stomach cancer due to family history or certain premalignant changes, before you start long-term use of NSAIDs, for unexplained iron deficiency anemia, and in some cases of functional dyspepsia, which is ongoing indigestion where other causes have been ruled out. Treatment for H. pylori typically involves a combination of several medications, usually taken for 10 to 14 days. This cocktail approach is used to maximize effectiveness and minimize the chance of the bacteria becoming resistant to the antibiotics. The key components generally include antibiotics, such as amoxicillin or clarithromycin, with the specific choice depending on local resistance patterns and your allergies. Proton pump inhibitors, or PPIs, like omeprazole, are powerful acid-reducing medications that are crucial because reducing stomach acid helps the antibiotics work much more effectively and aids in ulcer healing. Sometimes, bismuth subsalicylate might be added to your regimen, which helps by coating the stomach lining and has its own mild antibacterial effects. A common combination is bismuth quadruple therapy, which includes a PPI, bismuth, and 2 different antibiotics. Two of the most important things you can do during your H. pylori journey are to complete your entire course of medication and to follow up with testing. Even if you start feeling better, stopping antibiotics early allows the strongest bacteria to survive, which then promotes antibiotic resistance. This means future infections could be much harder to treat. Follow-up testing is vital. After treatment, your doctor will usually recommend another breath test or stool test to confirm that the H. pylori has been completely eradicated. This is crucial because you can feel better symptom-wise even if the bacteria haven't been fully cleared. Confirming eradication helps prevent future complications and recurrence. Remember, blood tests are generally not used for follow-up. If, by chance, the initial treatment doesn't fully eradicate the bacteria, please don't be discouraged. Your doctor will likely prescribe a different combination of medications. There are almost always effective options available. While H. pylori treatment is very effective, it's also common to experience some side effects. These are usually temporary, but it's good to be prepared. Common side effects include general gastrointestinal upset like nausea, stomach pain, or diarrhea. These are very common with antibiotic regimens. You might experience taste disturbances, such as a metallic taste in your mouth, particularly with an antibiotic called metronidazole. Women may experience vaginal yeast infections, as antibiotics can disrupt the natural balance of beneficial bacteria. Some people might feel unusually tired or dizzy, and you may experience a mild headache. It's really important, if side effects are severe or unmanageable, or if you have any concerns, do not stop your medication without first talking to your doctor. They may be able to offer solutions, or adjust your treatment plan to make it more tolerable for you. While there isn't a specific H. pylori diet, making some dietary adjustments can certainly help manage your symptoms, reduce stomach irritation, and support your healing process. Generally, you might want to limit or avoid foods that can irritate an inflamed stomach, such as spicy foods, acidic foods like citrus fruits, and high-fat or fried foods. Caffeine, alcohol, and carbonated beverages can also increase stomach acid or cause discomfort. On the other hand, several foods and habits might be beneficial. Probiotics found in yogurt, kefir, or supplements are highly recommended. They help replenish good gut bacteria and can help reduce antibiotic side effects. Foods like berries, broccoli sprouts, and green tea contain natural compounds that some research suggests may help fight H. pylori. And generally, choosing lean proteins and easily digestible carbohydrates can be easier on your stomach. For eating habits, try to eat smaller, more frequent meals, avoid eating too close to bedtime, eat slowly, and drink fluids between meals. The good news is that successful eradication of H. pylori significantly reduces your risk of developing several serious conditions, including peptic ulcers, gastric malt lymphoma, that rare stomach cancer we discussed, and gastric cancer. However, for some individuals, even after successful H. pylori eradication, your gastroenterologist might recommend ongoing surveillance. This is particularly true if you have a strong family history of stomach cancer or if you were diagnosed with certain premalignant changes in your stomach lining, like atrophic gastritis. Surveillance might involve periodic endoscopic examinations to keep a close eye on your stomach lining and catch any potential problems very early. This personalized approach ensures the best long-term health outcomes for you. While complete prevention isn't always guaranteed, you can definitely reduce your risk of getting H. pylori again or transmitting it to others. Key prevention strategies include practicing excellent hand hygiene. This means washing your hands thoroughly with soap and water, especially after using the bathroom and before preparing or eating any food. Ensuring food safety. Always cook all foods thoroughly, particularly meats. It's also recommended to avoid raw or undercooked meat and fish, as H. pylori has been found in these foods, especially where food handling hygiene might be a concern. Drinking safe water. If you travel to areas where the water quality might be questionable, always stick to bottled water. And finally, while not the primary route, it's wise to avoid sharing personal items like eating utensils or toothbrushes, or kissing, with individuals who are actively infected with H. pylori. In conclusion, receiving a diagnosis of Helicobacter pylori can feel overwhelming at first, but it's truly important to remember that this is a very common and, most importantly, a very treatable condition. For the vast majority of people, with appropriate testing and the right treatment plan, complete eradication is possible, and this often leads to a significant improvement in symptoms and better long-term health. Your role in this process is crucial. Understand your own situation, always complete the full course of medication as prescribed, and follow up with your healthcare provider for testing to ensure the infection has been fully cleared. Simple lifestyle habits, like good hand hygiene, food safety, and thoughtful dietary choices, can also play a role in preventing reinfection and supporting your recovery. But remember, every person's situation is unique. That's why working closely with your doctor is absolutely essential to ensure your care is tailored specifically to your needs. If you suspect you have an H. pylori infection, or if you have any questions at all about your treatment or diagnosis, please do not hesitate to seek professional medical advice. You deserve a clear path forward, and with the right information and care, you are already well on your way.